If you are taking just one medical prescription for one medical issue, or more than one medical prescription to treat the same or multiple medical issues at the same time or near time, if you are not side effect, black box warnings, contraindications, interactions careful, the side effects of taking one or more multiple medical prescriptions at the same time or near time for single or multiple medical issues can generate side effects that are worse, far worse, than the issue or issues you are trying to solve. Prescription, a written order by a doctor for a specific medical treatment. Medical prescription protocol. Patient profile, patient medical history, prescription history, urine sample, side effects, black box warning, contraindications and interactions, medical prescription core protocols, prescription side effects, unintended reactions or secondary impacts that happen when you take an authorized medication going beyond its main medical goal. Prescription black box warning. The U.S. Food and Drug Administration, FDA, strictest safety alert, formatted as a bold black bordered notice at the top of a drug's label, highlighting serious, life-threatening, or permanently disabling risks. Contraindications. Red flag before prescribing a medication to a patient. A medical condition, allergy, or situation that means a treatment should not be used because it is harmful. Interactions. A change in how a drug works when you mix it with other medications, foods, drinks, or health conditions. An example, you have two medical issues, A and B, and you have two prescriptions, Y for A and Z for B. It is imperative that you check side effects, black box warnings, and contraindications interactions for Y and Z for A and Y and Z for B, and an often missed prescriptions cross-check. Side effects, black box warnings, and contraindications interactions between both medical prescriptions, Y and Z. If you happen to have the typical senior bag full of medical prescriptions, you had a lot of cross-checking to do. Using your cell phone with AI makes the task quick and easy. Alfuzosin for benign prostatic hyperplasia, BPH, and ciprofloxacin for myasthenia gravis, cross-check is essential, as there are potentially serious medical issues when taking alfuzosin and ciprofloxacin together. My example, I was prescribed ciprofloxacin for a simple urinary tract infection, UTI. The prescribing doctor ignored the prescription protocol. I was given a 2-a-day, 7 days prescription. After taking 3 doses, day 1 and half of day 2, I felt that something was wrong, very wrong, and I stopped. I researched the internet for ciprofloxacin side effects, for black box warnings, and for contraindication indications. To my surprise and horror, ciprofloxacin side effects were potentially devastating. There is a ciprofloxacin black box warning, and ciprofloxacin contraindications interactions for myasthenia gravis patients, which I am, indicated that ciprofloxacin should not be, must never be prescribed for myasthenia gravis patients. The consequences were shortness of breath, heart palpitations, explosive nervous system jitters, loss of balance, loss of left arm lift, daily 3-mile walk reduced to walking with a cane to the mailbox. Some of the symptoms have subsided a little, as indicated by medical journals. However, the long-term outlook indicates permanent lifestyle compromise. If the ciprofloxacin prescriber had just taken a moment to check and apply simple ciprofloxacin protocol, the prescriber would never have prescribed ciprofloxacin for me. The lesson for me: I don't trust any medical prescription provider, and whatever the prescription, I do my research before I take a single dose. The lesson for you: you need to know the medical characteristics, behaviors, and potential consequences of taking a doctor-prescribed medical prescription. Be vigilant. No exceptions, no excuses. Nothing learned the hard way. The life you save may be your own. You will get what you settle for.